Hello everyone, welcome back on this channel. And here is the video on how, what and from where to study kinesiotherapy for first year of BPT for MUHS University. So all your doubts regarding the kinesiotherapy theory as well as practicals will get cleared in this video. So let us begin. So before knowing regarding the books, you should be very well aware regarding your syllabus. So your syllabus is displayed on your screen. So the first topic included is therapeutic gymnasium, in which you have to have knowledge regarding the different equipments used in therapeutic gymnasium, their classification into movable, non-movable, and identification of equipments, accessories. Also, one thing to clear that suspension therapy is also included inside therapeutic gymnasium. So whenever you will be having practical of either suspension or therapeutic gymnasium, you have to be prepared for the both topics as they are interrelated inside the syllabus. Okay, so for therapeutic gymnasium, you won't find any particular book in which you will find whole of the topic. So see, for suspension, you can use the normal Hollis textbook, and for the therapeutic gymnasium equipments, you have to follow PPTs given by your professors or any of them available on the telegrams, or else you can take help of AI tools also to get to know about the therapeutic gymnasium equipments. So for suspension therapy, you have it for your short case, and you have to be very well prepared regarding the how to tie the ropes, what are the different types of knots, different types of joints and their suspensions. So among the therapeutic gymnasium, suspension therapy is the one which you will be having for practice. Then comes the classification of movement. So for the theory part of classification of movement, even basic Dana Gardiner is also enough, but if you want to progress, then you can use Lakshmi Narayanan. Also in Hollis also there are some chapters including the movements and their classification. Now comes the joint mobility. See, for the movements and joint mobility, the basic question part is the definitions, types, contraindications, indications, then principles. So for joint mobility also, again the same terminologies. You have to be very well aware regarding the indications, contraindications and principles which you'll get in the Dana Gardiner. But for the practical use, you can follow Kisner for joint mobility, and you have to be aware about joint mobility for individual joints of our bodies. So regarding the goniometry part, the theory of goniometry, you can get the information in basic information in DINA, but complete information of goniometry is not given. So for goniometry, you can use Cynthia Norkins for goniometry. So goniometry edition is a different edition of Cynthia Norkins, which is different from the one which we use in kinesiology. So I'll show the images of the front pages of all the textbooks which I am mentioning right now at the last of the video, but listen carefully of what topics I am telling and what are the type of questions that are asked in each topic. So for goniometry, the most repeated question is the type of goniometers. Basic thing, you can get it in Lakshmi Narayanan properly. Also, if you want in detail, you can follow Cynthia Norkins of goniometry. But for the practical purpose of goniometry, you have to use the Cynthia Norkins goniometry edition only, and you have to follow the checklist given in that word to word and step by step in order to get full marks in your OSPE exams. So I am sure that now till now onwards you must have done the first formative in your colleges, and you might be well known regarding the OSPE thing. Also in my past videos I have clearly mentioned regarding the formative exams, practical patterns and the OSPE format examination. You can refer that video too. But in brief, for OSPE you have a checklist sort of thing in which every step is given a mark, and then all marks are counted according to what you do in front of the examiner, and there'll be assigning you marks. So for goniometry also, checklist is the most important. Again, for movement and joint mobility also, checklist is the most important thing. Then the basic evaluation of vital parameters. So for vital parameters, rarely theory question comes, but if theory question comes, this sort of thing. So we don't have a particular book in which you'll find vital parameters, but I do have notes of vital parameters. If you want, I can provide you with that, but for now you can follow the notes or follow the PPT which is given in your colleges. See, vital parameter is the thing which is a short case asked in your practicals. So again, checklist is most important. Temperature measurement, BP. So BP, I think you must be knowing from your physiology practical point of view also. Palpatory, auscultatory, they teach you there also. So method is same. Heart rate, pulse rate, again same. Respiratory rate is also very easy to check. Chest expansion and chest excursion. So this is the thing. So most commonly these sort of assessment uh, a demonstration will be shown in your colleges. If not, then you can follow YouTube videos for them also, but make sure that you follow the auspice sheet of your colleges in order to pass the formative. Then is interpret and explain the findings of assessment of the above mentioned parameters. So see, though your in your OSPI Viva is not included, but then too you have to be stay prepare for the MUHS examination. So there you should be aware of what are the conditions associated with these parameters if they are altered from the normal rate. So for that you should be aware regarding the definitions, normal values, abnormal values, and the clinical manifestations or the clinical conditions for the vital parameters. I hope you are clear with the vital parameters thing. Now is the assessment of sensations, reflexes, and tones. So for sensation, reflexes, and tone, you'll get all these topics in a book named Susan O'Sullivan. So this is a big fat book. You can refer it from your library or PDF format, and you'll get all the definition as well as practical part of sensation, reflexes, and tones from that. So also this topic is mainly practical oriented, but if they ask you in theory, so maximum times they can ask you the classification of sensations, classification of reflexes, types of tones like hypotonia, hypertonia, atonia, and what are their causes. So here also your physiology knowledge is very important, and you should be clear about the basics and what structures are responsible for the this type of sensations, reflexes, and tones. Then comes therapeutic soft tissue maneuver, which is in other language called as massage. So for massage therapy, you can follow according to the MUHS book suggestions. They have allowed you to follow the book of Hollis of massage edition or therapeutic maneuver edition, but you can refer to one extra book which is also known as Sinha. The author is Sinha. You can get that book in PDF format also, or else from your library. So you should be aware regarding the massage for face, upper limb, lower limb, back. So these four massage techniques you should be aware, and again the subtopics also. So I want you to make a flowchart sort of thing for learning the theory of massage, and then you move on to the practical part, as unless and until you are not clear with the basic techniques and their uses in massage therapy, you won't be able to do that in practical, as in practical they want a proper sequence of techniques. If you break the sequence of techniques, then you won't be getting enough marks to pass the examination. Okay, and also for each technique you should be aware for their indication, and in general also for the theory questions, indications, contraindications, principles, and you should be aware regarding the checklist of massage uses, effect, everything. Then for relaxation you can follow Hollis, but exact checklist is not given in Hollis. So again you should be attentive in your college when there is a demonstration of relaxation technique. Otherwise you can follow YouTube videos for relaxation. If you want, I can provide you with the checklist for relaxation. Now come aerobic exercise or aerobic conditioning. So for aerobic you can again refer to Kisner. So in Kisner you'll get the theory part, But for the practical part, again, a single book is not available. You can use your common sense to find out a warm up and cool down exercise. So basic thing is warm up and cool down only, and following the checklist like assessing the vitals before warm up, after exercise, and then after cool down. So this is the main thing which normal student forgets when they are doing the practical in exams. So this is one thing. For warm up and cool down of every part of your body, you can get YouTube videos for that, but please make sure that whatever sort of exercise you're selecting, you should be aware of what muscle is getting stretched, what is getting strengthened, and how it is giving a aerobic conditioning sort of effect on your body. And again, in aerobic conditioning, there is one hidden topic which is group and recreational activities. Again, this is available in Hollis, normal Hollis edition. Okay, so now the last topic is yoga. So for yoga, definitions, principles, physiological effects of asanas, pranayamas, benefits, contraindications. So there is not a single book which you can follow for all the yogasanas. For yogasana, you can either refer to multiple PPTs given by many professors from the colleges, or else you can refer to the books I'll show you subsequently. So you should aware regarding the asanas in standing, asanas in sitting, asanas in supine, and asanas in prone. So whenever you're describing or whenever you're showing yogasana, you have to demonstrate the asana to the model. So for that, you should be knowing about how you are going to perform the asana. You should be practicing the asana regularly so that you can do that effortlessly in front of the examiner, so that you can demonstrate it easily to your model or to the patient. So in exams, they may ask you a single asana for 7 marks, or they may ask you group of asanas in standing or sitting, anything in a long answer question, 15 marks. And principles, the ashtang yoga principles, 8 principles, you should be aware, that also comes for 7 marker. So this is one thing. And for each asana, suppose for tadasana, you practice the stick diagram is important, then indication, contraindication, then starting position, then releasing position. Everything should be written in your theory paper. Also you have to mention it while demonstrating it in practical. Also which muscles are getting stretched, also the muscles which are getting strengthened, this should be there. And do's and don'ts should also be included in your theory as well as practical exam. So these all points which I told you should be prepared for each and every asanas by you, so that you don't get blank in the exam hall or in front of the examiner in practical. So I hope that yogasana thing is clear. Now let us move forward. So these are the practical topics. So first is regarding the movements. So for movements, you have to show active, passive, assisted, resisted movements. See, in I know that movements come for a long case, but they don't ask you to show all the techniques. They just give you a joint and tell you the one technique to do that movement of that joint. Suppose they'll give you wrist active movement, so you should be knowing at least 5 to 6 exercises or movements in which you will be demonstrating active movement of wrist. Okay, so such type of questions or topics are given in your practical exams. Now is therapeutic gymnasium, techniques of various accessories. So if your college has a well equipped therapeutic gymnasium, then you can expect this question in your exam. But if they don't have that properly, so even if you have that in your practical exams, you be very well prepared for the viva part only, because if you don't have that utility in front of you, you won't be able to describe the use. So for that, theory part should be clear. But if your college is having a well equipped gymnasium, then you should be aware regarding the theory also as well as the practical usage also. Then comes suspension therapy. So I yes, all the colleges have a proper suspension unit, at least one. So you should be aware regarding the suspension therapy equipments and positions, patient position, then how can you give suspension therapy for each and every joint, and what are the indications, contraindications of giving suspension therapy. Then come relaxation procedure. So yes, Jacobson's and Laura Mitchell, these are the two types of relaxation you can easily prepare for. Then is therapeutic soft tissue maneuver or massage. Again, I told you upper limb, lower limb, facial and back massage. This is asked in examination. Then yogasanas, I already mentioned previously. Aerobic exercise for self and others, same. Vital parameters in different body positions. So see, even if you get a single vital parameter to assess, suppose they'll tell you to assess blood pressure, so you should be doing or starting it from supine, sitting and then standing. That means you're progressing the positions, and you have to mention that what are the effects or what are the results you are getting when you are altering the position. Also you can add one more position, that is after exercise or after exertion. Then comes assessment of sensory system, tone and reflexes. Again, for the sensory senses, you should be aware regarding the deep senses, superficial senses, combined cortical sensation, and you should be having a proper kit to check the sensory system. I have already mentioned a detailed thing in my practical kit video. You can go and check that. Tone, again, easy part. You should be aware regarding the agonist and antagonist of each and every muscle to check the tone. And reflexes, again, which muscle or which tendon to palpate and where to put the hammer to get a reflex, accurate reflex. That is one thing. And then is the measurement of joint range of motion using goniometry. Again, you have to follow proper checklist. You should be aware about which type of goniometer you should use on which type of joint. So that is one thing. Yeah, so the recommended textbooks by MUHS are displayed on your screen. So the books which I mentioned or which I have used in my first year were Dana Gardiner, Margaret Hollis, Massage Edition, Exercise Therapy Edition, Kistner, again Goniometry, Cynthia Norkins. Then yes, for yogic exercises, Datta Ray is also available, but PDF is not available of this book. You should get that from your library. Then comes this book I have never used, muscle testing thing. Lakshmi Narayanan, again very simple and lucid language. Then comes reference books. First book I have never used. Second also not used. Third not used. Fourth also not used, and fifth also not used. So basically, most of the topics of first year of kinesiotherapy are very well demonstrated in the recommended textbooks only. No need to go for the reference books. But if you are interested and you have the sources easily available, then you can use the reference books. So now I am showing you the images of the front covers of the textbooks I mentioned while describing each and every topic, so that you will get an idea about which textbooks should you refer. So see, this is the one which is Dina Gardiner basic book, which I think all of you might have read once. Then is Lakshmi Narayanan. This one is the exercise therapy edition of Hollis, and this one is the massage edition of Hollis. You can see it here. Then this is the Norkin, Cynthia Norkin edition of goniometry. This is Carolyn Kistner, Colby Kistner. Then this is the Sullivan. So this Sullivan is only used for the reflex senses and tone for first year. So yes, this is the most least used in your first year book. For yoga, as I told, there was not a single book I used. So I used this one, which was Yoga and Rehab by Nilima Patel, which is from JP publication. Then this was one book, Complete Idiot's Guide to Yoga by some author named as John. So yes, this was one book, and you can see it. And mainly I used health and physical education textbooks of class 12th of Maharashtra board, of that means of HSC and of CBSE, because physical education textbooks have all or most of the yogasanas which are included in our syllabus, and it includes all the points which you should cover and answer. So I would recommend that before referring a particular author's textbooks, you should refer health and physical education textbooks of HSC as well as CBSC of class 12th. And yes, this was, I guess, textbook of open schooling. I'm not aware of the board, but yes, there is a concept of open schooling, I guess you might be knowing. So this was one book from them. And yes, this was it for yoga. And I hope that you are clear regarding how, what, and from where to study kinesiotherapy. If you have any sort of doubts, you can put them in the comment section. I'll surely reply you when I am free. Yes, thank you. Don't forget to like, share, and subscribe for more such videos.